my name is Mia Baum.
Hi, my name is Mia Baum, and this is my Disease of the Cell project. I will be discussing Gaucher disease in this project. So, what is Gaucher disease? Gaucher disease is a rare lysosomal storage disorder that results from a deficiency of the enzyme glucocerebrosidase. The cause of Gaucher disease on a genetic basis is mutations in the GBA gene on chromosome 1q21. It is inherited in an autosomal recessive pattern. This disease can be found in any person, but it is most common found in the Ashkenazi Jewish population. There are varied types of severity of Gaucher disease. Type 1 is the most prevalent form. There are 3 types total that present symptoms such as hepatosplenomegaly, bone pain, and hematologic abnormalities. In the cell, there is an enzyme called glucocerebrosidase. This is an essential enzyme responsible for breaking down glucocerebroside, which is a lipid component, into glucose and ceramide within lysosomes. Enzyme activity is reduced or eliminated when a gene mutation occurs in the GBA gene, which codes for glucocerebrosidase. This leads to substrate accumulation within the cell's lysosomes, as the cell is no longer able to effectively break down glucocerebroside. This accumulation of glucocerebroside disrupts lysosomal function and other cellular processes. This overall mutation is what leads to the formation of Gaucher cells. Gaucher cells are engorged macrophages laden with lipid-filled lysosomes, which contribute to tissue damage as well as systemic symptoms. Gaucher disease is inherited in an autosomal recessive pattern. This means that both parents must carry a copy of the mutated gene for the disease to manifest in their children. The most prevalent mutations that cause Gaucher disease are N370S and L444P. Again, these mutations lead to glucocerebroside accumulation within macrophages, disrupting normal cellular functions. There are 2 main metabolic pathways affected by Gaucher disease. Overall cell metabolism is disrupted by the accumulation of cerebroside in lysosomes. More specifically, lysosomal dysfunction occurs. This impaired degradation of glucocerebroside leads to cell damage and inflammation. In terms of cellular function, lysosomal activity ceases to break down substrates and leads to lysosomal storage. Overall, this accumulation causes more inflammation and cell apoptosis, otherwise known as cell death. There are several organs involved in Gaucher disease. The most impacted, however, are the spleen, the liver, and bone marrow. Symptoms tend to manifest as splenomegaly, which is the enlargement of the spleen, hepatomegaly, which is the enlargement of the liver, and bone lesions. Other clinical symptoms include fatigue, anemia, and an increased susceptibility to bleeding and infections. Currently, there are 2 main treatments that are available to treat Gaucher disease. First is enzyme replacement therapy, or ERT. ERT replaces the deficient glucocerebrosidase, which in turn allows lysosomes to break down the stored glucocerebroside that was being built up. The second is substrate reduction therapy, or SRT. SRT reduces the production of glucocerebroside, which in turn limits the substrate accumulation within lysosomes. Overall, Gaucher disease takes a number of disciplines to manage. Dietitians help manage the nutritional needs of the patients, while physical therapists address the mobility issues that come with the symptoms of the disease. And finally, there are dialysis technicians that assist in managing the renal complications caused by the disease. As for diagnosing Gaucher disease, genetic testing is used to identify the specific GBA mutations, which is essential for family planning. Another method used is enzyme assays. These are used to measure glucose ribrosidase activity. This provides clinicians with precise genetic information for diagnosis and potential carrier screening. The DNA analysis confirms the mutations for Gaucher disease. There are several research projects on Gaucher disease. Gene therapy is a topic currently being researched. Gene therapy has the potential to correct underlying genetic defects. Early trials have shown improvements in both enzyme activity and reduced accumulation of glucose cerebroside. There are also several investigational drugs targeting novel pathways, as well as newer therapeutic options for managing the disease. As always, researchers and clinicians are always researching potential cures, as there are none currently. Going deeper into patient care, personalized medicine is another avenue of current research. This tailors treatment plans based on the individual's genetic profile and disease severity and type. The hope with this form of care is a more effective, holistic treatment with less harmful side effects. Finally, combination therapies are another form of treatment. The idea is to combine multiple different treatment types to form a comprehensive plan for disease control. There are multiple ongoing studies that are researching the best combination of treatments. This is a very likely form to become a standard mode of comprehensive care for those affected by Gaucher disease. The future of Gaucher disease treatment is promising. There are multiple avenues being explored to improve the patient's outcomes. Advances in gene therapy, substrate reduction, enzyme replacement, personalized medicine, and combination therapies hold the potential to significantly enhance the quality of life for individuals with Gaucher disease and possibly provide long-term solutions or cures. Ongoing research and clinical trials will be crucial in realizing these advancements and integrating them into standard clinical practice. Innovative research in gene therapy and molecular medicine shows great promise for developing a potential cure for Gaucher disease. Early gene therapy trials have demonstrated significant improvements in enzyme activity and reduced substrate accumulation, suggesting a shift towards more effective and potentially curative treatments. Emerging therapies targeting novel pathways could offer additional options for patients who do not respond well to existing treatments. Increased collaboration among researchers, clinicians, and pharmaceutical companies is driving the development of innovative treatment modalities. Personalized medicine is also gaining traction, allowing for treatments tailored to individual genetic profiles and disease manifestations. Clinical trials and research studies continue to explore combination therapies and novel drug candidates, aiming to enhance patient outcomes and quality of life. The future of Gaucher disease management looks promising with these advancements on the horizon.